her not to push yet while you get all these packages open, because every single thing in your kit is sealed up. And you should do this in practice because you want to pop everything out and open and have it ready. There's a sharp scalpel in this kit to cut the umbilical cord. Be careful with that. It's a real scalpel. But the trick is that you have to have it ready for when the cord cutting time comes up. So you're going to just get it open, all your packages.
Do we give that to the parent like they do in the hospital?
The scalpel?
Yeah.
No.
They gave us the scissors.
They give you the cord scissors. Some kits have cord scissors, and I don't care what you do, but it's just sharp, and it should go in the sharps container so that you guys don't leave it on scene or whatnot. There's also this really cool cutting tool that Mr. Fontaine ordered one year that are neat, and what it does is it clamps and cuts the cord at the same time. And we really did practice it on something to watch it work, but it only works once. So once you do it, you have to put the cord clamps back up onto it to play with, and it's really sharp. It's razor blades, so be careful with that. Okay, you've got the pad for after when the mom's bleeding a little bit. You have a maternity pad, white side to mom, guys, not blue. Absorbent side is white. Guys,
get that right.
so goes in there like that. Huh? It won't soak anything up, yeah. You want to open your cord clamps, see? Huh?
If you didn't say it.
About the blue and the white.
Yeah.
I wouldn't know.
They be putting the blue on.
You have obstetrical towels. That's to clean the mom's vaginal area. You're going to clean anterior to posterior, where the baby's going to touch on its way out. You don't have to scrub her whole birth area up and down and all around. What you're doing is you're taking one of these, opening the package, wiping top to bottom, all the way to her rear end. I can't, rectum. Open the next one and do it again. Anterior to posterior, guys.
Actually, the skill sheet says cleanse the perineum.
So, what do you girls know about cleansing the perineum and wiping up? You don't do that, right? Because you're bringing bacteria up to the birth area. So you want to wipe down, front to back. There are alcohol pads in there. Don't clean the mom with alcohol. She'll be mad at you. And it burns. But as well, this is probably to wipe the cord down where you're going to cut it so it's not gooey and slimy. So I believe that's why they're in here. I've not really asked anyone, but it's not for cleansing anything, except for maybe the cord so that your scissors or your scalpel doesn't slip. Okay, that works. You have gauze pads in here. They're called sponges. Those are for excess bleeding, wiping up anything you need. You have these 2 really absorbent towels, or maybe 4. Cool, I used to only give you 2. And this is to wipe up the baby, clean it off after birth, so that because it's kind of gooey and wet, it might have a little blood on it, so you want to use the towels to do that. You have a bag to put your placenta in when that's born. That's the afterbirth. You have sterile gloves in your kit, and I'm not going to show you how to do that right now. You can practice that in lab. It's not a skill that's easy, so you want to practice putting sterile gloves on. And then this is the drape. You get one really nice drape to cover over the mom. And when you're practicing, you guys, the way you want to do it is open the whole thing up. Don't just go, okay, I draped her. Because that's how you practice, and that's just ridiculous. You're covering the mom up for privacy, and also you're making yourself a sterile field. Like, that is all you want to be looking at, is just where the baby's coming out. Okay? Go down a leg if you can with your long ends of this, so that it's wrapped in underneath her leg or whatever, so that you can just have that exposed. Say you're at Kmart or in the back of the freeway and people are watching you, and then you got a trauma. But